Hello, my name is Carol. I'm an MSA student, Faculty of Pharmacy. Today we're going to talk about schizophrenia. So what is schizophrenia? Schizophrenia is a split mind, which is a disease of the brain, or a psychotic disorder that interfere with thinking or mental and emotional responsiveness. So what are some myths of schizophrenia? People believe that schizophrenic patients have different personalities, or dangerous or out of control. But other people believe that they are hopeless case disease and they need to be hospitalized. So, what are the mechanism of action that leads to schizophrenia? Some people believe it's psychological or physiological, but actually it is a physiological problem, as schizophrenia occurs when dopamine levels in the brain increase, so induces schizophrenia. Also, glutamate receptors, when they decrease in the brain, they cause to schizophrenia. Causes of schizophrenia. Some causes are physiological and some causes are psychological. Concerning the physiological causes, they are genetic or drug abuse like LSD, cocaine, and amphetamines. Also, pregnancy can be a physiological cause too, while the psychological causes are stress and social interaction. So, next we're going to talk about the symptoms of schizophrenia. There are three types of symptoms of schizophrenia: positive, negative, and cognitive. So, about the positive symptoms, there are agitation, hallucination, disorganized thinking, and delusion. So, let's talk about agitation. Agitation, in simple words, it's the increased irritability and tension. The patient always feel under stress or tension and always nervous and have an anxiety. While hallucination means that they see or smell or taste things that doesn't exist. While the disorganized thinking, they start having problem tracking their thoughts and conversation. Like they start seeing themselves a popular person, or seeing that the TV or the radio conveying messages to them. Also, they start making words or phrases that doesn't have a meaning except to themselves. Moving on to delusions, which is the fourth type of positive symptoms, it means that they have a false or illogical, strongly held beliefs. They start feeling that external forces like aliens are controlling their thoughts or actions, or they think themselves someone popular, and they start like a popular person, like a Superman or a prophet or a Jesus. This is the end of positive symptoms. Moving on to negative symptoms. Negative symptoms means that the person lack or miss something in their personality, while it's already available in normal people. For example, they start having lack of confidence, lack of motivation, and social withdrawal. Uh, this is what negative symptoms mean. Moving on to cognitive symptoms. Cognitive symptoms is that they have ability doing anything, learning, studying, or even understanding others. It's always having the difficulty to do anything. This is a cognitive symptoms. So let's talk about the treatment. We have two types of treatment: typical and atypical treatment. This is concerning the physiological treatment. Typical antipsychotic is the second generation. For example, clozapine or famotidine, it blocks the serotonin receptors, while the atypical is the first generation. For example, perfenazine, which blocks the dopamine receptor, but it causes extrapyramidal symptoms or side effects. While the psychological treatment is the family therapy, showing love from the family can help improve the symptoms, or by arts therapy, they can start going to arts classes to help expression their symptoms and focus on their cognitive symptoms and help to improve it. Also, a cognitive behavioral therapy is done by doctors that try to explain to them their symptoms and show them ways that they can help improving it. So, next we're going to talk about the clinical trials. There was held two clinical trials. The first one was done on famotidine and perfenazine. These two drugs were given to a group of patients, 30 patients, divided into two groups. The first group took the famotidine and perfenazine and watched for 6 weeks, while the second group took the placebo drug and perfenazine. The result was found that both groups improved in the positive and negative symptoms, while the placebo group also improved in the cognitive symptoms, as they have psychologically developed that they are taking a placebo drug, so they improved their psychological problems or cognitive symptoms. While the second trial was done on the clozapine drug, patients took the clozapine drugs and they was monitored. They found out it really improved the cognitive symptoms and showed better results for the schizophrenic patient. Thank you, and thanks to EPSF for this nice opportunity.